So thank you so much, Indian Medical Association Junior Doctors Network. Thank you so much, Abul Hasan sir, for your introduction. Thank you, Venkatesh, and thank you, Vijay Karthikeyan, for your brief introduction about me. It's very nice when you get introduced by your own student. So
Yes,
I
sir.
want to be thank you so much for your introduction. So we will start the thesis. So the presentation. So I'm going to take a very easy approach to take thesis. As I have seen many difficulties in doing thesis, uh, I'm not going to say you start with research question, you go to hypothesis, null hypothesis, alternate hypothesis, kind of these things and all. It's not my cup of tea. That's you have to attend a research methodology workshop that is available in all the medical colleges. That boring stuff you carry on. So I am going to tell about the shortcuts. There are certain shortcuts are there. If you click the shortcuts, and you can get the thesis done. That's all. Okay. So no need to, and you have to understand certain easy parameters to get the things done. And some reporting guidelines you should make sure that depends on your research question. And my presentation is not only for a computer medicine person, even all the clinical pages should get benefited. That is my goal when I prepare the PowerPoint. I remove the toughest stuff of that. Suppose I want to do a sample size calculation for a case control study. I'm not going to say about that. It is a very it is a statistician work. You are a doctor. You are not a statistician. Remember, when you do a thesis, you are a doctor. You are not a statistician. That you should keep it in the mind. Then you should approach the thesis. Okay. So we'll start with the share my PowerPoint. Okay. So is the PowerPoint visible?
Yes, sir. It's visible, sir.
So myself, Dr. Suthanthira Kannan, Assistant Professor, Department of Community Medicine, ESIC Medical College Hospital in Chennai. So what is the meaning of this is? Thesis is somebody says true happiness end since it starts. Okay, so that is not actually, that is there when I was doing thesis. My thesis got the best thesis award in Kerala, but when I did the thesis, it really my true happiness ended. I had a lot of family issues coming up when I started the thesis, but because I don't know the shortcut, there was nobody to teach me how to do the shortcut. So here we will start the thing. Okay, so we will convert into a real happiness. Okay, so how to plan and execute a thesis? Okay, thesis is not a cut, copy, paste work. You want to cut, copy, paste in 2 weeks? There is a guide called How to Cut, Copy, Paste, a beginner's guide. It is available in the Google. Don't read that book. Okay, in 2 weeks, cut, copy, paste, that doesn't help. Because of repeated cut, copy, paste, your keyboard may break, but thesis will not come up. Okay, so beware, especially you are doing a DNB PG. Your DNB PG means there is a there is a complete database is there all over India. There is ICMR database is there. Each university has their database. So you cannot cut, copy, paste and thesis. Okay, so don't do that. Prefer do your original work. Okay. So if you steal from one author, it is called plagiarism. If you steal from multiple other, it is called research. Don't do that. Okay. So somebody's one of the student even recently I am a member of scientific research committee and ethics committee of my own institute. We are seeing this kind of things using this chat GPT. Okay, now chat GPT using the doing the research discussion, that also not going to help because we have a software called Turnitin that detect chat GPT content. Okay, so beware. Even many universities have this Turnitin software to detect the chat GPT content. Some of the universities where I am a consultant, Tamil Nadu MGR Medical University, I was there, KNR University, Hyderabad, Rajiv Gandhi. So these are the universities, they have Turnitin software. So it will easily detect the chat GPT. And also it is upgraded to a level that even the which prompt you used, that also will come up. Okay, so don't do this. Okay, some of the private institute also, even Ramachandra Medical College are in the process of buying this package in their Turnitin. Okay, and Turnitin also a plagiarism software, so don't do that. Okay, so we will first the thesis life cycle started. We will start with the review of literature. So we will start with the research question. From the research question, we will do the review of literature. So research question is what is known, how did they study, what are the findings and gaps. Okay, so then again from after revealing the review of literature, you will again modify your research question. So initially you have the research question, then you use the review of literature, then again review of literature, you may modify the research question. So then from the research question, you will go for specific objectives. What are the objectives I am going to study? So what do you want? What do you want to know from our study? Then we'll go for protocol preparation, study design, methodology, and tools. Then we'll get the institutional ethical committee approval or institutional review board approval. How to achieve the objectives we will discuss in that. Then data collection analysis will do in the actual study. That is called in the actual study. Discuss, conclude, and recommend. So what are our findings and future actions? And dissemination of the findings in publications, conferences, and media. So that means how to make it known to others. And again, next research question, the cycle will continue. Okay, so research is a lifelong process. How to select a research or thesis topic? Actually, as a student, there are certain institutes where student can select the research topic, but there are very few institutes that they promote your ideas. Normally, the guide will select the topic. Okay, the guide will select the topic based on the guide's area of interest or guide's the talent or experience in conducting the research topic. Or you do multiple brainstorming in the department before starting this and come up to the research topic. So this is how the thing, but majority either the guide selection or brainstorming will help us. Okay. So the the topic which you select should be finer. What is finer? Feasible, interest, novel, ethical, and relevant. Feasible, let's see what is feasible. It's feasible means you should be finished in time and also in terms of month. Let's say your PG period is 36 months, 3 years, no? MD is 3 months, so 36 months. In the exam preparation, you will become something called EGPG, exam going PG, so 6 months over. So 30 months only. Then topic selection and approval, the discussion, fight, conclusion, depression, again 6 months over. So 24 months only remaining. In the 20, suppose if you include a follow-up study, only 18 months is there. That 6 months follow-up is there. Some people like anesthesia, surgery, orthopedics, they will do some procedure and they are doing the follow-up of the procedure. So again, 6 months is over. This is data analysis and reporting will take another 3 months. To do analysis, to sit, write, and results discussion will again take 3 months. So remaining 15 months only over. So only 15 months is available for your data collection. Okay, so in these 15 months, you should prepare questionnaire, you should validate the questionnaire, you should do pilot study of the questionnaire, and you should repeatedly do the analysis of the pilot study. Then you do the actual study, data collection. Everything is there only in these 15 months. And in these 15 months, even Vijay also knows that peripheral postings will come, NMC inspection will come. Okay, 90% of the colleges, PGs are used for NMC inspection. NMC, by the time when you complete your PG, you may know thesis or research subject, but you thoroughly know what is NMC inspection. So that is a real story in many colleges of the country. The government will provide seats, but you will be used for NMC inspection. So only 15 months is there. In this 15 months also, a lot of personal things are there. So you should be vigilant. You should know how to calculate sample size. You should be very clear in the protocol itself. So doing multiple review of literature in the protocol itself help you to come up with a beautiful data collection period. So this data collection period is the very tough period, but if you prepare well, you can actually have a good data collection. So suppose especially for a clinical PGs or even community medicine public health PGs. So before starting a data collection, make sure that how many case load per month. Let's say I am doing a study on systemic lupus erythematosus. Okay. Let's say there is a 20 cases per month in my OP, in the OP which I visit. So 15 months of data collection. So monthly 20 cases. If if you are able to get the 300 sample size or below 300, then it is a good thesis. Am I correct? Suppose you are doing the thesis on diabetic neuropathy complications. There should be diabetic neuropathy 20 cases in your per month. Because the 300 is a sample size, they will expect a feasible sample size. Okay, so make sure that. So if it is a required sample size, suppose your required sample size is 200, well and good. If your required sample size is 400, then it is not sufficient, right? So required sample size should be more than the feasible sample size. Okay, so required sample size is 300 here. So feasible sample size. So what are the facilities? Then you should see the feasibility in terms of the facilities you available to execute the study. Laboratory or imaging. We had one reason is that homocysteine levels to predict the acute myocardial infarction. but the homocysteine lab testing is not available in the institute. The patient has to go outside, so that should not be done. And somebody wants to study the endoscopic litoscopic cholangiopancreatography in imaging the pancreatic head. That is one another study was the come to our institute committee, but in our institute, ERCP is not at all there. What we will do is we will refer to some peripheral hospital. From there, they should do that, but that should not be done. So the laboratory test, you mention your protocol, or the imaging procedure, you mention your protocol, should be available in your institute to execute the study. So facility is not available, she should not do the study. If it is there, well and good. Suppose it may be the part of routine care, that test which you are doing. Suppose there is one study, the prognostic value of cystatin C in acute renal failure. Cystatin C is a marker that will do in the sample of patients in our setting. There are many people, many settings may not do, but in our setting they do. So if it is a part of routine care, it's okay. That can be done. But you should not force the patient. Like I told the example, in my institute, ERCP is not available. They will refer to ESI empaneled hospitals. From there, ERCP done, but they should not, even that also should not be taken into consider. Okay. So make sure that. So ethical committee will have objections in terms of funding and how you get this investigation done. Okay. So make sure that. So first what we'll see the feasibility in terms of the cases. This is the one thing which you will remember. If you're clinical PG, if you're doing a study, or even in pathology PG or anything, any PG, so make sure that the case load should be 20 per month. So that sample list will be 300. Normally with the thesis, in our experience, rarely thesis samples will go to more than 300. Very rare, very one or few. Okay. That can be done in the community medicine, community-based studies. So there are three solutions for that. When you want to, suppose I want to study the ERCP method to diagnose pancreatic head. If the institutional funding is there in AIIMS, JIPMER, PJ Chandigarh, there is something called intramural funding is there, or there is something called ICMR fund is there. Every year there is a ICMR fund. Venkatesh very well knows about this. He is one of the recipient of this ICMR funding of the thing. So he knows that some NGOs or they can provide a fund for your thesis. If you are doing a study in tuberculosis, TB consortium fund is there. Okay. Or sometimes you have to spend from your own money packet. Suppose even the test is not there. I told homocysteine levels in acute myocardial infarction. So even your sample is maybe 200. Even if you can test the subsample of this by your own packet money from your own savings. So that can be done. If that is not there, then better you think changing the topic. So first establish the feasibility of the study in terms of time, in terms of the equipments available, in terms of fund available. Okay, then complexity of the study also you have to see. That is really minor aspects. There should be some clear assessment method should be there. Suppose you want to measure the depression, or you want to measure some mobility after orthopedic procedure. What type of scale you are going to use? What type of scores you are going to use? That you should be clear of. And dependencies, whether sometimes what will happen if you want going to do a blood sample collection for your husband, the wife will come and say that shall I be a part of study like that? So that kind of things can be ruled off. If it is to be concerned, we can include. So we can think about that. Then interest. Whose interest the study is taken care of? If the PG thesis should be, my perspective is that student interest, sometimes guide and mentor interest, and our institutional interest. Sometimes the institution itself have these kind of areas. Suppose in my institute ESIC, they want to study the economic evaluation of the ESI benefits compared. So that can be taken by community medicine PG. Sometimes guide's expertise may help you. So when the guide suggests some topic, don't argue with the guide. Okay. He may be good in tuberculosis. He may be good in, let's say, hernia repair. He may be good in open aortic central fixation. He or she may be good in infertility treatment. So better what guide says, you can follow that. Okay. Don't never argue with you. Right. So that may be, some of the people's thesis have become their future career interest. Okay. So students, as a student, you may not have expertise in logistics. You might not have expertise in funding and network. Because when I started my PG in Kerala, my this is not my thesis, it is purely my PG guide's interest only. She told about you do drug adherence in HIV. You need not go community because she knows the logistics problem. I may not be know the language, or maybe not be know the how to access the people. So my initial interest was in palliative care. That is the guide will not accept, but at the end she is correct, okay, because she know about the logistics and funding and this thing is there. So what is the purpose of PG thesis or dissertation? You have to get published in a very good journal, okay, it will be published in this journal, or your study should be in the Cochrane library, okay. So there are difference between research and PG thesis. As I told, PG thesis have limited time and resources. I told in the first itself, it is not 36 months actually. You have only 15 months for your data collection. Okay. So no time limit and more resources will be available for your research. Suppose you want to do a research at per se. Suppose I am an assistant professor, I can do a research. There is no time limit. There is no can ask me, Kannan, you should finish this time, nothing like that, right? Okay. So research and guide. So they should always be in touch with each other. Okay, so suppose on the first year there is the guide give the title, you should not see him or her in third year. Okay, they may forget. Okay, then novelty. So this is another mistake you do. Okay, what first mistake you do? Without knowing the case load in your hospital, you directly start with the data collection. So that is even any PG, any postgraduate you are doing, make sure the case load in a community also and also in the hospital also. Yesterday also on pediatric PG come up with that's hypernatremic something called hyponatremic dehydration that I NSU. So how many cases per month is? There are only 7 cases in our NSU. But sample size comes around, it comes around 180. So 7 into 15. So around 100 cases only possible. So make sure that is the first. Second one is meeting your guide often to help you to fine tune your thesis so that the journey will be much easier. Most of the time, this is the mistake you do because of the fear or something. So don't do that. So make sure to update you about your guide about what research work you are doing. Or you may tell openly that this is the fear difficulties you are facing. He or she may help you or may not help you, but you should do your duty. Novelty. So this is PG's thing. This is a very novel topic only I should do. I should not do a novel thing. So that not like that actually. The novelty means in the existing research, new research, actually there is nothing difference. Novelty may be in the objective, novelty may be in the methodology, novelty may be in the value. Suppose we are doing a study on evaluation of the Anemia Mukt Bharat. It is already done in many parts of the states. But what new objective we are adding? We are adding the adolescent, normally Anemia Mukt Bharat, that is adolescent anemia. We are checking the other types of anemia also, whether it is microcytic hypogamy, macrocytic, that also we are testing to the peripheral. That is one objective you are adding. And we are doing something called forced field analysis in the qualitative research we are adding. Normally methodology, evaluation methodology is quantitative survey. We are adding a qualitative methodology. So topic is same, but we are adding one point in objectives, one point in methodology, so that some value, some X value, we may not know what X value we are going to get, but there is some value we are adding to the new research. Okay. So what constitutes a novelty? It is a study adding any value to the existing evidence. Similar study socially or demography and unrelated data. So the evaluation of the Anemia Mukt Bharat, it is done in many parts of the country, but it is not done in tribal area. So that is our objective, tribal area. So same objectives, but the tribal area is different. Okay. Same design only we are going to do, but we are adding the qualitative component. Similarly, same topic. Okay. So when you do it, this is topic, the topic need not be, need not be what to say, the new topic. It can be add upon objective or upon the design. So existing research may have small sample size. So what I say is, suppose you decide a topic on a study, always go to review of literature, take the limitations, read the limitation of the study. You may get a good how to improve your study. They may have done with small sample size. You may increase the sample size. They may have done with too poor methodological quality. You can add some robust method, how to measure that. Or any conflict of interest may be there. You can get the clarity in that. So novel study means new dimension, new variable, some answer to unanswered questions. Or new preventive strategy or new treatment regime can be a novel study. Okay, so perform a thorough review of literature, read the limitation part, you may identify the lacunae. So that comes through to novelty. You can write in your protocol that we do a review of literature. This is not done. So in our study proposal, let's say I give example of in the anemia with Bharat evaluation study in the many parts of the country, the types of anemia has not been evaluated because the treatment differs. In macrocytic hypokalemic anemia, the commonest condition causing this condition is hypothyroidism. So in that iron folic acid has no use. Better you have to start with thyroxine, that may help. But so that is one novelty we are adding. And we are going to add what is the field level problem in procuring the drugs in terms of anemia mukta bharat. Okay. Ethical. I see the study you are doing, whether it is ethical or not. Whether it is a prospective study or retrospective study, whether it is the human beings or not. And what is the institutional ethics committee approval? Is there any undue risk in doing this study? That also should be evaluated. So suppose a proposed intervention is associated with high risk, that should not be done. Okay. So risk versus benefit ratio you have to see. Okay. So suppose you are doing any beneficial intervention to all a group of participants. Suppose you are doing a new diabetic drug with the metformin, means one group getting metformin alone, another group not getting the drug which is actually beneficial. You should make sure that they also get that after your study may be done. Okay. Next, the parents or guardian should be there, consent should be there if it is less than, if the study samples are less than 18 years. So retrospective studies there should not be any undue risk. Consent or waivers of the consent may be taken. There should not be any additional cost to the participant. Relevance of the study. The study which you are doing should be relevant to the clinicians. The study you should do should be relevant to the patients, administrators, and the stakeholders. So intended purpose of the research study, you should be in purpose of time, place, and the person. Depends on the understanding of the magnitude and distribution of the disease. Let's say I cannot do Nipah virus in Tamil Nadu because it is not there. But I can do attempt in the places where the Nipah virus is there. I cannot do Casanova forest disease in Andhra Pradesh. Cases may not be there. But I can do that in Karnataka or sometimes Kerala when the case is there. Okay. So etiology or factors associated with the outcome should be then. What is the intended purpose of any research study is you should have better accuracy. You should reduce the false positive, that is type 1 error, and false negative. Okay. So simple, safe, and economical method should be used to achieve your objective. So for this, you should do thorough review of literature. Okay. For doing thorough review of literature, you can use you can use ChatGPTs, but for writing, you should not do that because the Turnitin software can detect the ChatGPT content. Nowadays, there is a software called Human AI, where it will detect where the particular prompt used, and from the prompt how many art searches that also can be find out. So don't do that mistake. Always be sincere to that work. So do thorough review of literature. But for the review of literature, there is an app called GPT called Consensus. Consensus is CONCENSUS. It's a GPT. We can use your to identify the study so that we can read through that. Okay. So write your objective as a prompt. The Consensus GPT will give you the study titles with the indexing of the journals also. Okay. So actually, the intended purpose of the research study is you should not do any harm to the patients. The tablet the drug which you are using, the procedure which you are doing, or any surgical procedure should not harm the patient. It should be relevant in terms of to find out the cause and elimination factors. So I repeat again, what is final? Feasible. It should be in terms of time and cost, interest to the clinician, interest to the patients, interest to the stakeholders, interest to the policymakers, novelty, ethical, and should be relevant. Okay. So next to come to how to write a good scientific title. The scientific title should be needed when you do the put in the database. Okay, see, suppose you are doing a study. Let's say you are doing a study on micronucleus in carcinoma intraepithelial neoplasm. You publishing the study in a good article, but if your title is not appropriate, good. Just like that, you put micronucleus in carcinoma nucleus, that doesn't help because your article should be cited by others. Then only your H index will improve. You got my point. Okay, so then only your citation index will improve. So to improve your citation index, your study title should be prevalence of micronucleus in carcinoma endothelial neoplasm in a tertiary care hospital. A retrospective case record study. You should put like that. Okay. Suppose in the study which you are doing published recently is evaluation of non-alcoholic fatty liver disease and its associated factors in low middle income countries. We are so that format should be there. Otherwise, you can publish also. There is nothing wrong in that. But the chances of getting your article cited by the other researchers may be less. That affect your growth. Okay. So that format is called PCOST format. PCOST format is P for population, I for intervention, C for control or comparator, O for outcome, S for study design and setting, T for time and type. So suppose example, anybody can put in chat box, what is the research title in that? Anybody can try. IVAN versus oral iron, pregnant woman. Anybody can type in chat box. What is the research title can be done in that? What can be study can be done in this? So here, what is the population? Population is the. You can answer. What is the population in this?
The participants can unmute and answer if you want.
Yes, population. Yes, somebody correctly answered. Participants are the pregnant woman. What is the intervention here? Intervention is the IVAN. I got it. You got it. Intervention is the IVAN. Comparator is the oral line. So I will propose the research title like this: a randomized control trial to assess the effect of. I'll come this. Okay, population is pregnant woman with anemia. Intervention is IVIN. Control is oral iron. Outcome is serum hemoglobin. Study design I can perfectly use RCT. Time I not mentioned here. Okay, so randomized control trial to assess the effect of IVIN versus oral iron in improving hemoglobin level in pregnant woman. Okay, or otherwise. Efficacy. Efficacy is the term is the output variable in randomized control trial. So efficacy of IVIN versus oral iron in improving serum hemoglobin in pregnant woman. So this is the PCOST format we will use. So what are the objectives is there? Objectives is very, very important because objectives forms the lighthouse of your study. From the objective only, you are going to calculate sample size, etc., etc. Okay, so this will help you to find where you are. Okay, so that we can achieve the things. Okay, actually based on objective only, we will do the sample study design. We can calculate the sample size and study tools also. How many objectives should be written? There is no hard and fast rule. Okay, you can write any number of objectives. Nothing wrong. But when you write more than 2 or 3, it will increase the complexity of the research. Okay. Simple research question, one objective. Suppose to estimate the prevalence of depression among elderly, that is one objective. Complex research question is, there can be more than one objective. That may be primary objective, that may be secondary objectives, or 1 to 4 objectives. Don't put more than 5. That makes your study complex. Suppose primary objective is to estimate the prevalence of depression among the type 2 diabetes. Secondary objective is to analyze the association between HbA1c and severe depression and assess the impact of depression on treatment compliance and self-care practices among the diabetic population. So that is secondary objectives. But scientific way to write the objectives. For quantitative research, what are the verbs you should use? For the quantitative research, you can use the verb. This is available in the basic course in biomedical research where you have to write if you not appear for the exam. So to determine, to compare and to estimate, to assess. And the descriptive questions like comparison group or intervention, predetermined hypothesis, analytical questions like comparison group should be there or intervention could be there, predetermined hypothesis could be there. So action verb may vary to estimate, describe, measure, quantify, explore. Explore means when you write any qualitative research thesis. Action verbs is to determine, to investigate, to examine, to compare. Okay. So when you, what are things you should avoid? You should avoid the word look at, to appreciate, to understand. This understand is the commonly used verb, action verb that should not be used in quantitative research. Okay. Because understand is again a subjective phenomenon. That will, what may I understand may not be understandable to you, or you may understandably may not be applicable to you. So to know, to recommend, that should not be there. So come to the SMART criteria of writing the objective. It should be specific, measurable, achievable, reliable, and time bound. Okay. So example, a study to assess the negative impact created by comparing body image perception and self-confidence level among adolescents with normal weight and obesity. Anybody can tell whether it is up to SMART criteria? Yes or no? Please chat in the chat box whether it is yes or no. A study to assess the negative impact of the created by comparing body image perception and self-confidence level among adolescents, normal weight and obesity. This is a study which we are doing as a part of interns project. Okay. If it is somebody saying yes, somebody saying no. Okay. You can say whether it is yes or no. Any one of you can please unmute the mic, whether it is, you say whether why it is not SMART. Yes, Jeffia, Dr. Jeffia is talking. You can, I'm not able to hear you. You can tell whether it is why it is not SMART or it is SMART. Anybody please unmute and tell whether it is based on SMART. Okay, I'll tell the answer. So objective is not following SMART criteria to understand. Okay. SMART criteria specific. What specific? How they are measuring the body weight? Body weight is not a specific criteria. Measurable. How they are going to measure the body weight? I told there should be a robust assessment method. Attainable. Attainable is done. The study can be done. No issues. Reliable. How they are measuring the body image, perception, and self-esteem? How they are measuring the what is a normal weight? Somebody clearly answered. Why it is called normal weight? Time bound, not vegetable. So how can I change into SMART criteria? Okay. To compare the body self-perception assessed by field ideal difference score between normal and obese in adolescents. To compare the self-esteem level assessed by Rosenberg self-esteem score between normal and overweight adolescents. So now you see, I have added a assessment method in the form of a score, field ideal difference. So action phrase, specific, measurable, attainable, reliable. Yes, because reliable means even after repeating measurements. Suppose my samples is around 300, is a multi-center study. I am in Chennai, you may be in Mumbai or Pune or Hyderabad, anywhere. If at the same question I give it to you, you should be able to produce the same result. That is a reliability. Time bound, yes, same. Next coming to is, you write the introduction, objectives. Now we are going to the literature search and reference management. Why to review the existing literature? Because our justification of the study should be done. Why you took this research title? That title should be done. Okay. Second one is methods and tools used. How you design your methods, tools, sample size, how it you got. And the study, the more robust study should be done. How did you mitigate the challenges that should be information, and they should not do a critical approach. So this is another fact which will come later. Okay. So there may be a peer review scientific work will be there, or gray literature will be there. You have to mix the hybrid literature will be there. So these are the types of literature process. Peer review literature is journal articles you have. That is, so you know that when you publish a journal, you cannot publish just like that. Your journal or paper should undergo extensive peer review. So that journal articles, textbooks also peer reviewed only come back to us. So that is a peer reviewed. Conference proceedings also done. Unpublished work of the thesis or by the clinical trials or any treatment or technical guidelines you can use, that is peer reviewed. Grey literature comes around newspaper reports you should not use. Website blogs or content should not use. Survey reports, technical reports are comes under grey literature. Program related documents are comes around. Suppose the press information drew update, that is our program related documents. So there are gray literature, may true or may not do or may change by the time when you publish your paper or thing, may the concept may change. So better try to avoid this gray literature. Depends on your research question. Okay. Especially it will affect your clinical decisions. Suppose a Medscape or clinical keys, another thing software there, so that that will help you to clinical test support may be used, but with caution. Okay. So the commonly used journals for the review of literature is from Lancet, BMJ, any your topic, your field top journal, or any South Asian Journal of Cancer. Okay, so that's sample of journal articles. Databases are also available. PubMed, Embase, Science Direct, Cinal Plus, Google Scholar, PsycInfo, of any psychiatry articles that is there. Okay. What the advantage of journal articles? They are up to date. They have higher scientific quality, trustworthiness, because most of the things are peer reviewed. Presence of predatory journals may be difficulty. Publication bias may come. Or restricted access. Most of the journals article which may good can be restricted paid access. In that case, you may mail the author to send the article. Most of the times they will send because they also want their article to be published. So most of the times they send, but also there is another disadvantage and conflicting evidence may be there. You may one study they prove that oral iron is not at all effective in treating anemia compared to IV iron. So normally in our programmatic aspect, we are going with oral iron only. Okay. High volumes may not be amended for easy understanding and application. Suppose you're doing a study on carcinoma of breast. There are some 1 lakh articles are available. Okay. So which should we take, which you should not take, again is a question. Okay. So what are the scientific articles I should read to get the to find the cause and effect? Animal or rabbit studies, case report on case series, case control studies, cohort studies, randomized control trials, meta-analysis systematic review, clinical practice guidelines. Okay. So the animal or rabbit we better avoid if it is not on the humans. In case report and case series, there is no study design. It is just descriptive. Cohort study and case control comes under observation studies. RCT will comes under experimental study. And these two clinical practice guidelines, meta-analysis, systematic review, secondary evidences which we can use. So the articles which you should use is secondary and the experimental studies so that they can give you a better idea. And finally, the observational studies. Now a new methodology has come that is called umbrella review. Umbrella review, systematic review of systematic reviews. Network meta-analysis, another new thing has come. Network meta-analysis, meta-analysis of meta-analysis. Okay. So this is the dissertation database. Research Canada as a part of academic curriculum. Sometimes all your thesis book, one copy, should be preserved by the institution as recommended by NMC. And the university or country based also database are available. ICMR, we have database. Journal articles also. These are the various thing. This is the journal articles. Conference proceedings available, we can help us. Conference proceedings advantages is updating on recent advancements, criticizing scientific matters in front of public. The author can present, the audience will give you a different opinion. Scientific paper is not, but it is not peer reviewed. Conference proceedings usually is not peer reviewed. Expert opinions is not sufficient at the conference itself. There was a study that there is something called tinnitus in the eye. They did a study called phenytoin usage in tinnitus, and it was found to be effective actually in one of the national institute. But when they present in the conference, the experts in that they give a lot of phenytoin may cause obstacles erosion. It may affect the mastoid airspace. So should not use tinnitus. That is published in the conference proceeding, but it does not come as a paper. So Whether to use phenytoin as a you have to take a call. These are textbooks, the finest textbooks available. What are the advantages of the textbook is best is also conceptual information. Suppose you want to prove any story wise or concept wise thing, textbooks are the best source. Easy to understand, apply in the practice. Time lag from the evidence of publication may be there. Editor publisher bias will be there. The editor may write his or her own points. Okay, guidelines can be used. Best recommendation for treatment and diagnosis of the disease, but it is not available for every disease. Like for example, sarcoidosis, there is no treatment guidelines. Okay, so lack of frequent or regular updates may not be there. If, suppose you take animal bite updates, I think the last update is 2018 or 19. After that, no update. Actually, there are a lot of updates that are produced by APCRA, Association of Prevention and Control of Rabies in India. So my suggestion is go for the journal articles. Okay, surveys can be used, but it comes under gray address. This is various surveys. Census of India, Global Adult Tobacco Survey, New Mortality Survey. We have SRS, Sample Registration System Survey. Gray literatures are these are which I already told. Okay, gray literatures are broad in scope. So wide perspective, demographic thing is there, maybe up to date. Maybe only source in emerging issues like Nipah virus, gray literature is the only way. Better representation of local and social context may be there, but the trustworthiness depends on the source, newspaper. It is politically biased may be there. So we have to confirm the bias should be there. Could be cooperated but restricted with permission. So what the researcher needs to do? List the information need you have, scoping of the research you have, identify the right resources, which resources you want to study about the thing, whether it is textbook, whether it is a journal article. Better always have a good communication with the guide. Search in a systematic way. Okay, start from your research question thing. What are the difficulties you face during this doing the study? And always do critical appraisal. This is another lacune you are doing. Okay, what is the source? Whether it is a predatory journal or normal journal, trustworthiness, limitations should be there. So this is the very first level approach to provide the proper study design. Okay, so this is a flow chart to decide your study design. This is very common mistake done by the clinical PGs. So are we studying diagnostic accuracy of the test? Your research question. If it is yes, then the methodology is diagnostic accuracy study, which is itself is an entirely different study. There are different protocol guidelines are there. Are you doing any intervention? If it is yes, it is comes under RCT. If it is RCT, how many study groups you have? Single group or multiple group? Single group is single group before study or after entrance study. Multiple group is how are you allocating participant different groups? Random methodology, yes or no? Our observation studies, what is our study groups based on? Cohort study, case control study. What is the duration? If it is a prospective study or retrospective study or cross study, that is the most commonly do. How many study groups we have? Single group is descriptive, multiple group is analytical. So this helps us to decide what type of the study design you are going to put. This one chart will help you to what type of study design you put, but based on the study design, you can write the methodology. Okay. Suppose you decided your study is a case control study. Then you have to follow these guidelines to write your methodology. If it is clinical practice guidelines, there is a guidelines called AGRI guidelines. So I come from the base. Let's say for animal studies, there is a guideline called ARRIVE guidelines. You download the ARRIVE guidelines and you write the points. If it is case studies, there is something called care studies, care reporting. Okay. If it is observation studies, there is a stroke. Okay, structured observation studies. If it is diagnostic studies, there is a starred guidelines. Starred guidelines. If it is systematic meta-analysis, we have PRISMA guidelines. If it is RCT, consort guidelines. So these are the guidelines. Okay. So these are the guidelines available in the net. You download that. Suppose you decided first you do this flowchart. You will come home to your study design. Then you download these guidelines and write your methodology. If it is a qualitative research, you have CORAC, SPQR. For economic evaluation, you have something called Cheers protocol. For quality improvement, you have Square guidelines. Okay. So these are the softwares available for you to do the thesis. For sample size calculation, you have EpiInfo, MedCalc, Stata, okay, G square power. These softwares are there. For data entry, you use Excel software, Epidata, or Microsoft RedCap, Google Docs, Google Sheets are there. Okay. For data analysis, you have various softwares. SPSS are there, Stata is there, R is there, Metcalc is there, Jamovi is there. For reference management, you have commonly used Zotero, Mendeley, Citavi, RealWorks, Citation Medicine, ReferenceWorks there. For document management, alternately, you can use MS Office, Word, Dropbox, Google Drive, Gmail, Office are there. So you should use a cocktail of softwares. For each step, you have to use one software. Okay. So current scenario is multiple tools should be there. Steep learning curve dependent on the multiple softwares are there, because one thing is dependent on the another. Okay. For SPSS, we can do direct entry also, but better you put in the Excel than you have to load in the SPSS. So it's a complex, time consuming, costly, and limited membership and collaboration. You know, many of the guides may not be know about these softwares. So there is one software called CoGuide. It's available. We can browse to the site where all these are available in single software. The single CoGuide software will cover all the areas of your research, whether it is sample size calculations can be done there. Analysis also can be done there. This is based on a Python programming. So it is easy, less time, economical also. And there is collaboration mentorship available from this institute if you subscribe from your institute. So you can use either these multiple softwares, depends on your feasibility, or only one this software, CoGuide software, so we can do everything in that. Okay, so thank you so much for this opportunity. I have covered the most of the areas where the thesis can be done. So thank you so much. Any doubts you can ask me.
Thank you, sir. Thank you for a elaborate and informative session. So the forum is open for discussion. Kindly post your queries in the chat box.
The CoGuide link is reap.guide.in. Okay. You can use that. You can use my name also. Okay. I think the order is reap.coguide.in. If any doubts, you can ask. I think they are putting in the chat box, I think. Vijay sir?
Yes, sir. Yes, sir. They are in the chat box. So one doubt is that how to avoid plagiarism by paraphrasing. How to do paraphrasing there?
Very good question. Plagiarism is another separate topic which the time permits. We will do one second time. Paraphrasing should be done to be changing the grammar of the word, or changing the order of the line, or changing the punctuation or splitting. Okay, so we will have one more session on plagiarism, how to avoid that. The thesis itself is a one-day topic. So it's a very good question. So that can be done. So paraphrasing is just ordering the words. Okay. Next question. Yeah, somebody asked any about the CoGuide software. CoGuide software is a software. It is where all the steps of the research can be done in a single software. Sample size can be calculated in that. Analysis, Excel sheet is already, data entry can be done. Analysis can be done. And the output also will come in a PDF form. Okay, depends on your feasibility. Somebody asked me, kindly repeat again the objective. But objective part is you have to write based on the SMART. Specific, measurable, attainable, reliable, and the time bound. Okay. Another asked, any idea about the mixed methods? Yes, mixed methods is again a very big topic. You have to write the quantitative part and qualitative part, and you have to link that. Okay.
So they have asked whether a chat GPT or Google bot can be used for paraphrasing.
No, don't do that. You use by yourself.
Turn it in.
Turn it in. Turn it in. Consensus GPT for what? It is for the, suppose you can use Google Scholar to write your research objective, and the list of articles will come. But you have to open the, go again, put the search in a separate Google bar, and you have to start the article and you have to read it. But in Consensus GPT, the list of articles will come with the what are the results of that your objective. So that is the thing. Now you need not read the full article. That GPT will give you the thing. But that should be used for your literature only. Again, you have to use your own language.
So there is a query. Which is the best method or software to calculate the sample size for RCTs?
Medcalc
And whether it has to be solely based upon our parent study.
There should be reference from that, but you can use the Medcalc. It depends on your control groups or which arms do, single arm or double arm. You can use the thing, or you can choose something called Gegen's table. There is a table called Gegen's table, which is available in the online platforms or in the book called Leon Goudy's textbook of epidemiology. In the table, we can put what is the expected improvement in the outcome. We can come to the sample size in the each arms. That is called Gegen's table, GEHAN. Within how many years a study can be repeated? Depends on the study title and what novelty you are adding in your already published result, or what new information is available. Like COVID, remdesivir, they started some trial. Again, they proved it is not useful. Then they come up with another monoclonal antibody. They do that. Depends on the gap that is created in that knowledge database.
So again, we have few queries regarding paraphrasing, which website or software will be good for that.
A lot of softwares available. There's one more software called Quillbit or something like that. It's there, but I don't know. But again, better you use your own terminologies to. Better you go for splitting. I will take plagiarism separately. Splitting can be a better way to avoid the plagiarism error. I think Vijay also knows when we
Yes,
see the software called plagiarism X. Even splitting also it is according as plagiarism. So that should not be. So make sure that. So, but still change the full grammar of the sentence. Also. Maybe some AI tools will come to help us to avoid that. Still, plagiarism should be avoided. There is a softwares freely available is R. R is freely available. There is Jamovi is freely available. Jamovi is nothing but SPSS background only. Those who use Jamovi can know it's almost like an SPSS. In R background, we can give commands. Python also freely available. There is one more statistics software called Blue Sage Statistics. It is also very easy to learn. If you learn R, you can do not only your thesis, also you can do meta-analysis, forest plot, everything with R also. So my favorite is R. Depends on your expertise or learn to learn. I'm not putting in because SPSS data they're very costly and they have to be paid.
So any more questions? The participants can just put in the chat box, or you can unmute yourself and you can just ask the questions. So I hope there are no further queries.
Okay.
Is there a software for questionnaire development? For
Survey
one
Monkey.
questionnaire.
Survey Monkey is there for questionnaire development. Survey Monkey is there to develop the questionnaire. I can type the answer in that. Survey Monkey. You can develop the questionnaire. Google Forms can be used. Okay, develop the questionnaire. Is there any application to similarity index without Turnitin? Plagiarism exists. Some part is freely available, but again it is costly. Many of the institute libraries now have Turnitin. Now NMC recommends a plagiarism software should be there in their library. Whether they are checking or not, I don't know, but majority they should buy actually. Universities should be buy, colleges should buy the plagiarism software.
So most of the MJR University colleges are having Utkund and
Yes. Now they are mandatory now. Make sure plagiarism should be less than 10%. 20% is okay. Less than 10%.
if there are no further queries, shall we conclude? Participants, if you have any queries, just post in the chat box or unmute yourself. We have less
Or if
than 5
any
minutes.
topic to be discussed in the next
Q&A.
session also we can put, we can
Yeah.
answer that.
You can post your suggestions also for upcoming webinars. Any specific topics you need, you can just post.
Mr. Method studies can be done. Can be done. We'll do one session. Okay, the checklist is different. The separate checklist is there. Okay, like strobe and this thing. We can discuss that. Depends on the thing. We'll read about plagiarism and paraphrasing.
Yes.
We'll go next.
So what all should be included in the introduction of thesis?
Introduction of thesis. Two paragraphs about your research problem. Then burden of the disease with respect to the international, national, regional level. So then why you selected this topic. So these are the things. Basically, what you know, what already done, and what you are going to explore. So that is the thing in introduction.
So Hariharan sir, so any concluding remarks sir, from your side?
Sir, thank you so much for this wonderful session. I think it is really useful for anyone who's doing his thesis. It was a great time having you here, and thank you, Vijay Karthikeyan, for arranging this, and Venkatesh, who's also been working behind this. Thank you, Nanjavardhan, as well. Thank you all for joining. Let us meet again in another good topic very soon. I think we are coming up with a certificate course for doing research, and that will include certain days. So that we are formulating, and we will come back to you with that soon as well. Thank you so much for all the opportunities.
Thank you, sir.
Thank you. Thank you so much. Sir. Thank you, Vijay.
Thank you, sir. Thank you so much, sir.
Yes, sir. Thank you, Kannan sir. So something which I have learned in research is because of you. So during my post-graduation days, I think you have taught me many things. So thank you for accepting our invite and being a guest speaker, sir. So and I think so you are for a few sessions in our research methodology also you are going to handle.
Yes, sir.
So thank you for that, sir.
Thank you.
And please support us and in the further endeavors, sir.
Sure. We'll do.
Thank you, sir.
Thank
sir,
you.
Shall we conclude, sir?
Conclude. Thank you.
Yes, sir. Thank you, sir. So all the participants, there is a general instruction that a feedback link will be posted in the group in 1 week time, and once you just submit your feedback link, you will be getting your certificates in your registered mail itself. So kindly wait for a week time. Your certificates will be delivered to your registered mail ID, as well as the recordings will be provided in your registered mail ID. So thank you all for joining, and just stay updated for our future webinars and research methodology course. So happy learning. Thank you all.